I'll tell you my experience actually first, so you can actually comment on that. I graduated. Did my first bridge where I actually had to go to two virgin teeth, cut them down. I still remember that patient.
Yeah.
He couldn't afford dental implants. Wanted, because insurance covered bridges more.
Right.
And he came 1 week later, and he needed nerve treatment in both teeth.
I believe it.
That was very traumatizing to me. We did root canals for the two teeth, and that's back in almost 15 years ago or something like that. And at that, I made a decision that week that I'm not doing bridges anymore.
Yeah.
And because if he was my brother, I would not do it. I'd just do a dental implant. When did you start talking about that or seeing the difference of implants? Do you remember something like that?
I do. Been a practicing hygienist for about 13 years now, and I have to say, we did a lot of bridges in our first practice. Did some single implants here or there. It was more of the dentist kind of trying to get into that and practice with it in a way, but it wasn't something that everyone was doing. Our first line there was always a bridge, simple bridge. We submitted to insurance. And what I noticed, especially with high-risk patients, high-risk meaning, they have a lot of habits that can cause cavities. The bridge is just an unpredictable option, in my opinion. I can guarantee an implant for a lot longer. A bridge, it's going to depend on your habits. How well are you cleaning it? You can't really floss around it. You got to go underneath it. So it is just definitely harder to maintain. And I got to a point to where I'm like, it's just not worth it. And it's not worth, especially like you said, like I won't even consider it. If there's two healthy teeth that are doing great, why do I want to weaken those just to compromise to put a bridge?
So let's first introduce what is dental implants. How do you tell your patients about what is dental implants?
I say it's the closest thing you can get to what God gave you, is really what I say. I mean, it's truly what I believe. The structure of a tooth with the root and the crown to do the eating and the root to support that crown. That's exactly how an implant's going to work.
So just to show what Therese was mentioned, if we look at the teeth over here, this is healthy gums over here. We have 3 teeth. And if we go around, that's exactly what dental implants are. Basically, it's a titanium post. It goes actually and resembles the root of the tooth. And then it holds a crown on the top of it. So that's exactly what dental implants are. So once we lose a tooth, that's what dental implants are.